Hello, hello, everyone. This is Dr. Parks, and I'm here today to talk a little bit about just an introduction and overview of health behavior. And so this is chapter 1 of our text for our health behavior course. A lot of high-level information that we'll go into in more specific detail in future weeks. So I may have a slide that's very general. We're going to come back to that and talk about theories and frameworks and principles behind that. But this is just an introduction today to basically everything we'll talk about through the course. This isn't our welcome lecture though, so if you're looking for course specifics, assignments and deadlines and processes, that's a different lecture. But this is a chance to talk through some of the basic content in health behavior. So to provide a little context and background, one of the things that I want to talk about for a minute is the idea of social determinants of health. The idea that the environment in which we live, work, age, where we're born, where we grow, where we play, influences our health. And so when we think about things like economic stability and health and healthcare, social and community relationships, all of that influences our health. I tell this story in some of my classes, and hopefully it's not too trite or overly simplistic. But my freshman year of college, I was transiently homeless. I didn't have a place to live for about 6 months. And I was blessed. I still was able to go to school and find a few part-time jobs and eventually get a place to live and establish myself. But during that time, I remember making very little money and trying to decide, if I have $1.50, do I eat the, Taco Supreme from Taco Bell, or do I buy a banana, right? So we talk about, and I started taking health education courses and community health courses as I worked through my undergraduate major in public health. And I remember thinking, oh my goodness, who is going to make that healthy choice when they have to choose between something substantive and high calorie and something healthy? And of course, healthy depends on a lot of different things, right? But when we think about nutritional value, something that is good for you. So anyways, when I think about folks who face many economic challenges, different economic challenges, far beyond anything I've experienced, or hopefully what most of us have experienced, we have to think about how that influences health. We have to think about education level, social and community relationships, lots of different components influence health. And so this is a great graphic. This is one of my favorites from the Kaiser Family Foundation, and it reviews health disparities and how health disparities, differences in health outcomes across groups, quite often we frame it across race, ethnicity categories, but across groups, are informed by social determinants of health. And you'll notice here we've got economic stability. Are you in debt? Do you have medical bills? Do you have support? Do you have income? Do you have assets and employment? Do you have a job? Do you have housing? Do you live in a safe place that's walkable with parks and resources? Right? What's the geography like? Can you get to the store? Do you live on top of a hill or up in the holler? Education levels. What kind of early childhood education support did you receive? Are you able to read? Right? Higher education. Were you able to go to college? Is that something you chose to pursue? Food and food security, access to healthy food, food deserts, right? So this keeps going. And then we've got, of course, all community factors, community engagement, stress, relationships, and then lastly, our healthcare system. And you'll notice this is an updated version of the graphic. They've had a graphic like this for a little bit over a decade. But what they did is they pulled out racism and discrimination as a systemic factor, and they put it as a theme through all these things. Because racism impacts economic stability, it impacts neighborhood and physical environment, educational opportunities, food, all of it is impacted by discrimination. And so this is a really interesting graphic, but it shows that all of these are determinants, social determinants of our health. So they're all flowing to health and well-being, our mortality, when we live and when we die, our morbidity, right? How well we are during that time frame, life expectancy, how much money we're spending on healthcare, health status, and our ability to function. So really interesting graphic here. I also want to define a few key terms before we start our course. There's a difference between health disparity and health care disparity. So a health disparity is when one population or group experiences a higher burden of disability or illness. So there's a higher diabetes rate amongst African American or Black populations compared with traditionally, a homogeneous Caucasian population. So different disease outcomes, different disease incidence, prevalence, a little bit different from healthcare disparity. Healthcare disparity looks at the quality of healthcare received and the services. And so if you don't have access to healthcare and healthcare services, you will experience a healthcare delivery issue, right? A healthcare disparity. So, for example, when we look at breast cancer outcomes, certain populations may be more or less likely to have breast cancer, not terribly robust trends in that space, right? Breast cancer affects women of all different backgrounds, but the mortality rates are higher amongst disadvantaged populations because they can't get care soon enough. They don't get diagnosed soon. They're not getting their preventive screenings and mammograms, right? That limit in access to care, that healthcare disparity, means they have a negative health outcome of the disease. Not necessarily more likely to have breast cancer, but they're more likely to have significant morbidity, right? A bad experience, right? A prolonged experience of the disease, and perhaps mortality, right? So that's a healthcare disparity, access to care. And then health equity, we're going to define that in this course as a situation in which everyone has the opportunity to attain their full potential, right? And this is a slightly antiquated definition, so please ignore when we have those gender, that bivariate gender construct representative. We want to be inclusive, but that's the definition our text is using. And this, I think, is a great graphic that shows that what we do in public health is we remove barriers. Sometimes it's about helping to elevate, helping to support, but quite often it's about wiping out those barriers wherever we can. A lot of factors just contribute to disparities, right? And we look at disparities across different lenses: income categories, race, ethnicity categories, geographic areas. What's the rural versus urban experience? The example given here is across race, ethnicity categories, and these are disparities in mental health treatment. So 31% of white children with mental health problems, challenges, receive mental health services. And I want to say that's not acceptable. As someone who's worked with pediatric mental health, and my husband's worked with pediatric mental health, that is not acceptable, 31%. But it is even more startling that only 13% of children from diverse racial and ethnic backgrounds, right? When you think two or more races, when you think Latinx or Black, 13%. That is atrocious. The idea that 87% of those children are living without services. That's an example of a health care disparity, right? Access to care. So we want to take this broad lens, and we're going to talk quite a bit about the socio-ecological model and different approaches to improving health and dealing with social factors. So determinants are any factors that contribute to a person's current state of health. They can be limiting or supporting health. And you'll see here that we say social and environmental factors account for about 20%. And of course, these are round numbers based on different studies and different understandings of interrelationships of many variables. Healthcare is only about 10% of our health outcomes. Genetics is a chunk, right? Some of us are genetically predisposed to certain things. And then individual behavior that we're looking at with health behaviors, 40%. Now, again, these are round numbers. A lot of the social and environmental factors influence behavior. And so that behavior needle, right, what we think is normal, what we think is acceptable, how we interact socially, is driven by our social environment, can be, right, can be impacted in that way. If we live in a food desert, we're less likely to eat healthy food. If we don't have sidewalks, we're less likely to take a walk. You get my point. So we're going to be exploring some of these pieces a little more in depth. We're also going to talk about some really cool examples, some really heartbreaking examples, some really interesting examples of social determinants of health. The idea of how social media and having access to social media can actually be health limiting. The idea that the availability of community-based resources, some things that we may take for granted, the ability to go to a park or be able to be outside, different locales, different weather patterns. We have to think about how everyone's norm is different. Rural versus urban again, right? So we're going to talk about some examples of what influences our health. We're also going to talk about a very broad definition of social determinants of health. This is a very old graphic. I love it. I've used it for over a decade. This is from one of the original social determinants of health frameworks and articles by Dahlgren and Whitehead in 1991, all about the idea that our behavior is influenced and our health by individual lifestyle factors and decisions we make, our own little universe our social and community networks, and then more broadly by the general socioeconomic, cultural, and environmental conditions around us. And we'll talk about how that can come together. Things like transportation, residential segregation, which is still a problem in some communities, right? We're also going to talk about the link between social determinants of health and health outcomes and the weight of evidence that shows what a big impact the world around us, our environment, and our social realities make on our health, and how we can impact that as public health professionals. This is just a quick example. This is looking at the disproportionate impact of drug laws on Black and Latino communities. So this is the percentage of individuals of that race ethnicity who are in prison or jail for drug offenses, and how that the criminalization of certain activity has really impacted different communities. So you can see this is just an example of policy determining our health too. So policy itself can be a social determinant or a determinant of health. Laws can greatly impact our health. And so this is another good example. This graphic looks at immigration and the idea that people moving from country to country, language barriers, linguistic challenges, workforce challenges, documentation greatly impact your health. And then this one's another great example, but it breaks my heart. Oh, this kills me. Policy, again, is a social determinant. Legal aid. This graphic here, every time I see it, I'm just like, we know most of us have watched law enforcement cop TV shows, right? I used to watch Law and Order years ago, NCIS maybe. If you cannot afford an attorney, one will be appointed for you. We know that's criminal law in the United States. You get a public defender appointed for you, but you don't have any civil rights. So the point here is, if you cannot afford an attorney, one will be appointed for you unless you're losing your children or your home or your healthcare or your right to work, right? Any of those things that are so important. You don't have guaranteed representation from a civil perspective. So there are programs like legal aid that can assist. But when you think about that, when you think about immigration and Social Security and getting access to services, you're not entitled to legal representation for those pieces. And so this is a good example of where we have to create a system that supports the health of individuals, especially in these situations where we're vulnerable, right? We're in a tough spot. So just a couple more slides. That was kind of my intro to health behavior. This is the link between health and health behavior, which is chapter 1. And I want to talk for a moment about why people do what they do. And that is what this course is about. All of the different theories and frameworks. And you'll find that you'll read certain theories in this class. You'll listen to me talk about them and they'll resonate with you. You'll say, yes, I understand the health belief model and the idea that if I can increase my self-efficacy and increase my understanding of perceived, decrease my concern about perceived barriers, increase perceived benefits, I'm going to make a positive change in my life, right? You can understand that. Other theories you'll read and you'll say, I don't really understand the socio-ecological model. I don't really get the trans-theoretical model. That's not the way I think about it, or I don't think those are the real factors. So these were all developed by different public health, social, anthropological scientists who developed different theories. And by the time you're done with this course, you have a good understanding of, let's say, about 10 broad theories, but even more variations. And at the end, I think you'll be able to say, if I sit down with a client to provide health education services, or if I help design a program, or if I'm working with a group, I have a pretty good understanding of when they start talking about their family and their friends and their environment, what these levers and factors are and how I can help them. How we can design an intervention to help this individual or this community. And so we're thinking about why people do what they do, and that's what we're going to learn. We're going to learn all about healthy and unhealthy behaviors and how we typecast certain behaviors, but the full spectrum of human life and the different theories that explain that. And we're going to start out with a very broad definition of health behavior, the idea that our behavior is not always motivated by health. A great example of this, and we'll talk about this later on, we have a whole chapter about the idea that your health behavior may not be motivated by health. Great example of that is tanning. No one goes to a tanning bed and says, I want skin cancer. No, they say, I want to look nice. I want bronze skin. My friend is going, right? They're thinking about a beautification outcome, or a weight loss outcome, or a fun. No one drinks because they want to be unhealthy. They drink because they want to relax. They want to have a good time, right? So when we think about alcohol consumption. So I think it's important to realize that health behavior, we're really talking about almost all behaviors and all different types of motivations that may have very little to do with health, but impact our health at the end of the day. We're also going to talk about what it means to be healthy according to different theories, and how we think about our thought processes, how we practice really healthy, positive messaging with ourselves and the people we care about, and we build programs that support folks. We're going to talk quite a bit about ecological models. The socio-ecological theory is one of those, all sorts of models that involve some sort of ecology, the idea of an environment and factors in that environment, right? And behavioral ecology is specifically looking at an individual, their health behavior choices, those closest to them, their family, their friends, their coworkers, the society around them, right? Little bubbles building out like this. So we're going to look at all the various factors that impact your health. For example, you may be impacted by the political landscape, right? You may be impacted by a new federal law that's passed, or by your culture, by your family norms, by your community, all these different levels of influences. And this is a really great example from the CDC that looks at youth violence and youth violence interventions across these different levels. And we'll look at lots of examples again when we go into these individual theories later. I just want you to see this is where we're headed. We're going to talk about these multiple levels of influencing factors. Which levels influence certain types of behaviors, to what extent, in what ways, and where you can intervene. If you say, I want people to eat healthier, or are you going to deliver a program, an educational program for kids in schools? Are you going to create a farmer's market program that provides vouchers to communities for purchasing products from a farmer's market at no or low cost? What are you going to do based on what the real drivers are in your community? What is contributing to not eating healthy? Is it because there's no access? Is it because your workforce is working so much that there's no time to prepare food? What are these factors and how can you intervene? So we have to understand the drivers. We also want to be really, really mindful that when we design health education, public health, program planning interventions, we want to realize it's not going to be perfect the first time. So we have to try to understand those factors that are driving health, try to combat, counter, improve those factors, right? Improve the health of populations, intervene where we can. But then we have to collect data during the process and see where it's not perfect. We regroup, we intervene, we take our intervention, we regroup, re-engineer it, we try again. I like this one. It's Baby Yoda offering us a taco. Sometimes we don't get it right the first time, but we can regroup. So a couple questions to ponder as we move on into next week, and I hope this little brief intro was helpful. Is the idea of health behavior a meaningful concept? Does it maybe limit how we approach health issues? If we say, oh, we're dealing with health behavior versus human behavior with implications for health. When someone smokes, is that health behavior? Is it a coping mechanism? Is it something their family did? Right? Is it what they're doing and how it impacts their health? So I think that's a really open way to think about it. And I hope we can adopt that approach as we think about health behaviors and kind of de-villainizing the idea that, oh, that's unhealthy behavior. Well, it's a behavior that has certain implications for health. How can we change it? How can we empower that individual, that community to make positive change? All right, so thank you so much for taking a moment just to listen to this. I hope it was helpful to give you an overview of chapter 1. I will be sharing these lectures in each module going forward in the course, so you'll be able to see me talk through some of this. If you have questions, just reach out. I'd love to talk more specifically, right? This is intended to be short and succinct every week so that you can watch it really quickly. Maybe while you're, folding laundry, doing something around the house, you can quickly digest and hear what I have to say and move on with your week. You're more than welcome to take notes. However, I shared Quizlets. And if you click on the Quizlet link, it actually takes you to a magic note, which is a Quizlet set of notes from this lecture. And then it has the flashcards at the bottom. So if you're getting taken to the flashcards, make sure you're clicking on that link versus just going directly through Quizlet to my class, because that link takes you to the full notes page plus the flashcards. So you have a resource there too to test yourself. It's just really cool. All right. Well, thank you so much. Have a wonderful week, everybody.